years. Wouldn't we make more as a
Well, yeah,
so
so this part of Wicker Park, you can still get good numbers for condos and duplexes.
I think if you guys can mute yourself
Like stuff goes for around 800.
when you're not talking, I'm getting a little feedback there.
but it's double the profit.
I know it's hard when you're at home.
Or do you mind if I mute everyone?
2 units are 3 bedrooms, 2.5 bath. The building was originally built in 1885. It's around 20.
I'm muting.
It's beautiful. That is
All right, we'll go ahead and do the Pledge of Allegiance. I can't see John anymore, but I assume he has the flag out. So I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right.
really bad shape. And then the new sidewalk.
Did we have any public comment?
It's owned by the city. Clearly new windows. What am I looking at?
All right, and then I think I just need a motion to approve the September meeting minutes.
I make a motion.
A second.
I'll second.
All in favor?
Aye.
All right. So moving on to the new business, we had a request for a budget revision that I included in the meeting minutes. I think it's just a reallocation between the rent and utilities for $6,000. So if I could just get a motion to approve that reallocation.
I'll make a motion. Cindy?
All right.
I
In a
second.
second. Okay, all in favor?
Aye.
Aye.
All right. So I think that just brings us to the agency presentation. So I'm looking forward to hearing these tonight. So we have, I guess, a packed schedule of 7 presentations. So we'll see how this goes over this Teams meeting versus being in person, but hopefully it'll go well. So do we have Kathy from Link? Are you ready? There you are. All right, I guess you can just go ahead. I guess everybody else, if you want to mute yourselves, or Pinar, if you want to mute, and then Kathy, you can go ahead and start whenever you're ready.
I'm muting all. Okay. Oh, you need to unmute yourself, Katie.
Got it. Can you hear me now?
Yes.
Like a commercial. Can you hear me? Can you hear me now? Good to see you. See all of you. I love our CAB team. I love our community. We do so many great things together. Thanks so much for volunteering and being on the board, and for including Link for a couple of decades or more. And we love receiving those funds. I'm going to set my timer so I don't keep talking, and I'm going to try to read so it just streamlines it, and then that way you can ask questions of me. Link has been serving out here in Wentzville for over 28 years, and we love being the triage station of homeless or prevention of homeless. We love being prevention focused, because we know it's much easier to stay in those affordable homes or to keep your home and your address without losing that. We love being part of the community that works really hard with the 14-day notice of prior to an eviction, to work with 211 coordinated entry as a community as a whole. We work better together. The tools are great. The notes are there. The case management is fun, very necessary. That's always written in part of our grant for CAB funding. With case management, we're able to understand some of the barriers of survival, such as a job loss or a job change or a skill tutoring or mentoring. We believe in making a child care program, preschool here at the Hope Learning Center, a very affordable child care, because that's a huge barrier for a lot of folks to be able to pay for daycare for 1 or more children. We still have our ongoing counseling for students and adults and sports programs and our latchkey and the lunch program didn't get to serve this year because of COVID, but we did try to invent something new. Last summer, we fed 800 meals at summertime, but this summer we had to be creative and we called it Wacky Wednesday. We went into the Hidden Valley subdivision at their pavilion and brought them a wacky sacky surprise package. So there were foods in there that kids could eat, and there were gifts and treats and fun things like that. So we served about 100 children going into the community with social distancing and masks, of course. Counseling opportunities were to all ages. We're grateful to be part of CCRB funding as well. We served over 2,500 incidents of service using the CCRB funding, which it really is under your umbrella or with our monies working together as a team. We also had to be creative in the foster grandparent program, the program that's been in our nation for over 50 years. So this year, because of COVID, our grandparents couldn't go into the public schools to help or mentor or teach or work with kids unless they were IEP students. So we had to really be creative on this one. So we are in the process of creating and opening in October tutoring stations across the Tri-County area for parents and their children to learn and be tutored with schoolwork, whether it's virtual learning and they come into us by scheduled times, plexiglass, mask, and all of the social distancing things we have in place. And we also have them at local libraries over the Tri-County area, as well as even a gymnastics class. So the kids and the students who are virtual learners at home, they also get to tutor at a session with their gymnastics time frame. With many new ideas, it has been challenging, but someday I'm sure we'll look back and say, oh, this is very fun. Over the summer, we tested the tutoring program. It was very successful. I had an eye-opening experience of a who didn't know his basic math. So he's going into 4th grade this fall, and working with him through flashcards and things like that. One of the teachers brought him in, a 2nd grade teacher professionally, brought him into my office and said, Miss Kathy, look what he can do. And he was reading his flashcards. I watched this little kid going into the 4th grade struggle with 7 + 3 = 10. And I never looked at 7 + 3 = 10 the same again. Also, thank you, team, for allowing us to be part of the CDBG. I know I turned it into the portal instead of emailing it to Pinar, and that night you voted to accept it if you could find the application, and so we're grateful for that. We're in the training process as a community, and I'm the last one to sign the contract because I just wanted to learn a little bit more through the training first. Super excited to be able to use it though and help out with those fundings in our COVID crisis as well. Our public food pantry has never closed since March. It's been operating in the parking lot. We're still working with No Hunger Holiday. That is due this week, just in case you all need to know that, where it's the turkey and the full meal for holiday for Thanksgiving. And then we're also in the beginning stages of toy collection, and we have decided to have our Christmas store again this year. I just didn't want to cancel out on the birthday of Christ. So we kind of schedule appointments for that anyway, so we're able to continue social distancing. In 2019, Link prevented homelessness in the way of rent, mortgage, and utility to 194 homes with the money that you gave us, and I'm very honored to do that. We had 22 families that were helped in the way of hotel stays with your funding. We use CCRB for homeless families with children, things like that. So we love being the triage station and working with everyone in the community. The Continuum of Care of St. Charles County has asked Link again to be the fiscal agent for EWR, Emergency Weather Response Program, for the homeless and dangerous temperatures, so 20 degrees and colder predictions. It will look different this year. We've been working diligently behind the scenes in regards of a whole new way. We can't use our warming centers. Most of our volunteers are at the high-risk population and to receive COVID, and homeless have a higher risk of spreading the COVID. So we are looking into hotels, relationships with hotels, but it's just going to cost our Tri-County area more money. So that's EWR in the homeless way of things. And my 6-minute timer went off. So I'm not sure how long we all have to listen to Chatty Cathy. But if you have questions for us, I'll be happy to answer those. You guys are so cute looking at me on the screen. I like it. I've been loving this Zoom thing. It's like back-to-back Zoom meetings without driving. It's been great. Any questions for Kathy at Link? Again, thank you so much. You guys are awesome.
Thanks, Kathy. All right, we have Habitat up next. Lauren.
Hello, can you hear me?
Yeah.
Okay. So hi, I'm Lauren. I am the Grant and Development Services Manager over at Habitat for Humanity of St. Charles County. Right now we are in our 23rd year of building, and in that 23 years we have just broke ground on our 90th home that we build in partnership with our selected families. Our partner families do pay a mortgage on their home, and that is no more than 30% of the income that they bring in. This is ensuring that they are adequately prepared for homeownership and that we're not setting them up for failure, and that they are being put into somewhere that is affordable, safe, and decent for them and their children. Our families also put in sweat equity hours towards the building of their homes, working alongside our volunteers throughout the whole process. They also earn their hours doing financial education classes, and they also do classes on homeowner insurance, going through their closing documents before they do go through their closing procedures, and going with their volunteer support partner, and they create their budgets and they create their financial future for their mortgage that they are prepared. We hold our family selection process yearly. We just do it once a year, and we accept applications once a year as well. Our selection team and our homeowner support manager gather interest throughout the year. We send out applications and interest forms usually in January, and this is assuming that they meet all of our basic qualifications. And then our family selection team goes through their credit history as well as background checks, and we do a site visit to verify the need for the family. For this year in 2020, our selection process, we did start in February, and we had a total of 52 applications come through. And typically we do select our families by April, but due to COVID this year, we had to put our selection process on hold, and we were finally able to select our families by August of this year, and we selected 2 families. Right now, these families are working on their sweat equity hours, and we were successfully able to break ground on 2 homes in St. Charles City off of Transit Street. And so we have one home that is actually getting the trusses laid out tomorrow, and we have another home who they just got their foundation poured last week. So they are slowly but surely working on sweat equity hours. We are very carefully having volunteers come out. It's few and far between, not anywhere what it used to be, but our goal is to get these homes under roof by the end of the year so that we can get to work on the interior of the home and hopefully have them moved in by March of 2021. And the CAV funding that we received from you guys last year is being allocated towards these homes. We did request funding for the foundation towards these 2 homes with you guys. So that is put into use, and we are working hard on it. So thank you so much for that. These 2 homes right now are 2 single women, one woman who is raising her 2 granddaughters, and another woman who has 3 children, and actually one on the way who's due in February. So they are hopefully going to be in their home to celebrate that come March of 2021. So for this request, for our 2021 request, we are requesting for 2 homes again. We have one property in St. Charles 70 that will be a new build, and we have a home in St. Peter's that is actually a rehab home that we have started on and had to put on hold, and we're hoping to get back to it. We have gutted it completely from the inside, so our plan in next spring is to actually go in and put new walls up, new flooring, basically a whole new interior of the home with that. And our plan is to hopefully start family selection in January again, with selection in March, and hope to start breaking ground and starting on the rehab home by April or May of 2021. So that is our main request for this year. Thank you so much for your support as always. Throughout our years applying for CAB funding, you've actually helped us with 15 families in partnership. So thank you so much. And if there's any questions, please let me know.
Hey, Lauren, I just had a question about the house that's on hold. Was it COVID related or was it funding related?
It was actually related to, we were thinking of moving one of our selected families now into this home, but due to family size and the need for the family, it made more sense to put them in the home in St. Charles.
Gotcha, thank you.
All right, thank you, Lauren.
Thanks.
All right, next one up is Linda from Turning Point.
Hi, good evening. Thank you for allowing us to be here. Can you hear me okay?
Yeah.
Okay. Thank you for allowing us to be here. I am new to the agency, but not new to the to homelessness in our community. And so at Turning Point, we are providing different kinds of services which allow those who are homeless get housing, and hopefully then they were able to keep that housing. Because the population that we deal with are those who have experienced domestic violence, sexual abuse, human trafficking, they are all by definition homeless. They have escaped abusive and violent situations and have taken that first step toward healing. And the Turning Point is there to help catch them and to provide them with emergency shelter services. It is confidentially located, and the main goal for us when a woman and or her children come into shelter is to provide safety, security, and stabilization for them. So while clients are in shelter, one of the main goals is to establish a program for them that helps work them towards more permanent housing. We are pleased to partner with NECAC, with 211. We are members of the Missouri Coalition of Domestic Violence, and all of the member organizations work together, providing referrals and resources to one another, so that if one cannot meet a need, someone else might be able to. So we feel like we aren't just one organization operating alone, but part of many organizations working together to provide housing for these individuals who are survivors of abuse and violence. We see among this population that 94% of them are experiencing what we call financial abuse, because they have been cut off from their own source of money. So when they come to us, many come to us with the clothing on their backs. If they are lucky enough to have been able to grab their purse with their ID in it, maybe a cell phone, but they are in extreme poverty because they have no access to funds. And we have found that because of domestic violence, sexual abuse, human trafficking, that there is this systematic homelessness that these women are facing in our community. And we are pleased to not only provide response to them because of their homelessness, but to provide that continuum of care, wraparound services, that include general advocacy. So the advocate meeting with them, finding out, okay, what's the basic needs you have? And for some, it's just they escaped with no ID. And so the first goal is to get them an ID, get them a social security card, providing them with the supports that they need. Many times they need legal assistance, court advocacy. So we are helping those clients navigate that criminal court proceedings and what they need to do in order to start that process for themselves. We offer counseling services in-house, and we also have a substance abuse program because we find that there is a great number of our clients who are experiencing that as well for them. So the clients are receiving services. CAB has provided funding for us to be able to meet people where they are. So for the clients that are in shelter, they have allowed us to bring those women in off the streets, out of abusive and violent situations, and provide them with immediate safety and security. And it has also, through CAB funding, allowed us to help people stay in their homes. As we've all seen through COVID, people were losing jobs. They were furloughed from jobs. They were having to give up jobs in order to stay home with family members to care for them while they were ill. And so financial situations changed very drastically. And we saw an increase in the request for temporary housing financial assistance, rental assistance, and utilities assistance. And because of our CAB funding, we were able to meet many of those needs for those people to help keep them in their homes. And our funding request this year is the same. We know that there are still people out there who are struggling, who are hurting financially. And for us to be able to provide that funding through our CAB funds has allowed us to help people stay in their homes and receive the assistance that they need. So we are thankful for you and grateful for your support. Any questions?
I did have one question in your budget. Hold on a second. I've got to toggle over and pull it up. You
Okay.
have $5,000 for food. Could you just expand on what that is for?
The food is to help us provide food for our shelter clients. And then we also work with about an equal number of people in the community. They may have secure housing at the time, but they are, a paycheck away from homelessness. And so sometimes if we can help them with food, they can pay their rent.
Okay, great. Thank you. I just wanted to make sure that I understood it.
Absolutely.
I just wanted to say I thought your application was very well written. I really appreciated the documentation around community needs and community strengths. So thank you.
Well, thank you.
All right. Next up is Brad with Connections to Success.
Hello, can you see me and hear me?
Yeah.
Okay, thank you. Well, I'm Brad Lambert, and I'm with Connections to Success, and I'm happy to be back again. This is not the way I envisioned this meeting going a while back, but here we are in the new world. I'd like to start with just kind of giving you a status report of where we are currently with our homeless grant and how we are pivoting in response to COVID. Our enrollment goal for this current grant that we have is 50, and currently we have enrolled 20 people, which is about 40% in 7 months. And we are a little bit behind our target where we want to be, but we're comfortable that by the end of February that we'll be at the 50 that we're looking for. The outcome one is employment, as you've heard me talk about over the years, workforce training and employment are really at the heart of what we do. And unfortunately, that's been at the heart of what COVID does not want us to do. Our short-term employment target is 70%, and our actual number to date is down at 22%, which is a drag and is starting to pick up. I would say between April and June, over 40% of our total enrolled population that was working lost their jobs. So we've been going through a massive, not just employment, but re-employment effort to try to get our people back in a job situation. Our recidivism is very good. In fact, it's 0, and our target is less than 10%. So that's just a snapshot of our current grant. I'd like to talk a little bit about where we are today programmatically and actions that we are taking. All our staff began working remotely on March 17th. And as of early August, we now have an alternating skeleton crew that work each day. We've had 3 St. Charles employees test positive, so we are continuing to move slowly in trying to bring things back. All our training classes, life coaching, job development, interviewing have now gone from in-person to virtual, and this will continue for the foreseeable future. Zoom, WebEx, and Google Hangouts are our new best friends. You may recall last year I shared about a new partnership with the Wentzville School District. Unfortunately, that had to be suspended in March because of COVID, and we are now hoping to resume training in January. Also, our work inside prisons and jails have ceased due to COVID-19. But on the flip side, in July, we entered into a new partnership with Missouri Department of Corrections to actually train their corrections officers on doing the training inside the institutions, which would mean we would not have to go in. And we're hopeful to have this going by the end of the year. Another positive aspect is that one of our long-term goals that COVID made a short-term goal is creating an e-learning portal that can be accessed at any time via a tablet or cell phone, as compared to the scheduled virtual training that we do, to increase training accessibility for people that are maybe working part-time and have more time in the evening or weekends or whatever. And we're moving quickly to have this in place, hopefully by the end of the year. We are currently a member of the St. Louis Regional COVID Task Force, and they are forecasting thousands of displaced workers across the region that are going to need reskilled and re-employed based on COVID. So we're very hopeful that this technology is going to benefit us as we go to this big push in re-employing. So like many organizations, we're finding our new normal and moving forward as proactively as possible. Our 2021 application is essentially the same as 2020 with respect to enrollments, outcomes, and amounts. And I'll pause here for a moment to see if you have any questions or comments, and then I want to make a final statement.
Brad, what is the forecast? I heard you say that at the Regional COVID Task Force, you mentioned a little bit about employment. Can you just expand on that? What are the projections looking like, particularly for people that are working at lower paying wages?
Well, I don't know that they have their arms around really strong data at this point, Melinda, but it's many thousand of people that, I mean, without skills training, as you know, most of our participants move towards retail and hospitality industries. And those industries really took a hit when COVID came along. So we're Kathy is actually on the state workforce board, and they're working to try to develop some new shorter term skills training programs in high growth industries. But this is going to be a multi-year effort, and it's going to involve many thousands of people to try to bring the workforce up to the level where we were before. I know that's very general, but I don't have any specific data at this point. Sure.
I think Dave has a question.
Hi, Dave.
Dave, you need to unmute yourself.
Can you hear me?
Yeah.
Yes.
Okay. So, I might be stealing your thunder, but did I read that you're going to retire from the?
Oh, you're taking away my final statement. Stop it.
I probably have worked with you longer than anyone on the board, and I wanted to just extend a congratulations to you and your lovely wife. You've been tremendous to the community. So.
Well, thank you. And I wanted to close by sharing with everybody, and Dave stole my thunder here, that sometime in the first quarter of 21, Kathy and I are going to be transitioning from our roles at Connections. We started this journey 22 years ago, and I didn't have gray hair then. And we believe it's time to hand over the reins to new leadership. We will still play a limited role in the next year or so in a consulting role. And we also plan to explore some new opportunities. Unfortunately, nonprofits don't have robust retirement plans. So we will continue doing some things that put some money in the bank. But I want to just take this opportunity to thank the CAB board. You were one of our first funders for our Wheels for Success program back in 1999 when we were just getting off the ground to help individuals receive donated cars. You're one of the first funders that helped us with our social enterprise Sweet Success that provided training and employment in the baking industry. I even brought a basket of cookies to one of the meetings, and Dave, you were probably the only one there then. So I just want to thank you. This has been a great partnership, and we will continue it for sure. And new leadership will be back next year to meet with you and share with you all the good things we're doing. And I will turn it back to Katie.
All right. Thank you, Brad, and congratulations.
Thank you.
All right. Let's see. Denise with Our Ladies Inn.
Hi, good evening, everyone. First of all, thank you to CAB for helping to fund Our Ladies Inn to do the work that we do with our homeless pregnant women and their dependent children. Right now, with COVID going on, we have plummeted through having a change in how we provide, how services are provided. We currently have lower numbers because of COVID. We did begin with the full house. Can you hear me?
I think we might be losing you a little.
I'm sorry.
I'm sorry, I unmute again. Okay, Denise.
Okay, can you hear me? Is it clear?
Yeah.
Yes.
Okay, good. Okay. I'll just start over again. I'm Denise. I'm the program director here at Our Ladies Inn in St. Charles County. And I'm grateful to CAB for providing us funds to help us care for the homeless pregnant women and dependent children. We've been in existence since 1982, and we have 2 homes, one in St. Louis City and the one out here in St. Charles. Right now, we are working our way through COVID, which is a new experience for everyone, and we are currently still providing the services that our ladies need. How Our Ladies Inn works is we receive a phone call from Coordinated Entry or from other associate places like hospitals, and our ladies come here because they are homeless, they are pregnant, and we're offering them the services so that being homeless, they can have good health for them, their unborn child, and for their children. We work with our ladies when they come in. They have an intake with a case manager who, along with our counselor, our child advocate who works with the mom so that her children's needs are met. And we also have a nurse on staff. So with those team players coming in, working with the mom, a complete person-centered plan is created. And the mom has goals that she's looking to establish so that she can gain self-sufficiency. We also have within our facility, our counselor works with our ladies as well, and on the end of substance use and mental health. We refer our clients out to places like Preferred Family, so that a treatment plan can be incorporated for those moms that have had substance. We also have ways for them to attend meetings outside of a treatment plan. And we do that, and we do when we address the idea of homelessness, not just so much as giving our ladies a home and jobs to stay, but when we can help them work towards the issues that cause them to be homeless, saying mental health and the substance use and the trauma that they've experienced. Some of our women come from domestic violence background. So getting all of those things in play and then having children and being homeless is a really big plague. And Our Ladies Inn is here to help them take that next step so that they can reach sufficiency. We do work closely with Coordinated Entry, and they do via SPDET to put them on a list for housing. Our ladies, right now during COVID, we are shelter in place. And what I mean by shelter in place, when March 17th hit, we had to shut down and not allow our ladies to go out and work. And some of them were furloughed from their jobs. So now we are going into a phase where we can gently allow them to get back into the community and work, and keep in mind the safety of everyone in the house. So what that looks like, we have a staff person who transports our ladies. She would take them to work and the children to daycare if that applies. And we have a protocol that they follow when they come in, because there are still some women that have not entered into the community. We do transport them to their doctor's appointments, because being a maternity home, their health and well-being is priority. So we are still providing that service. As far as their meetings, we have connected them with virtual NA meetings so that they can stay abreast of their treatment plan. Our numbers have gone down because we're cautious as to how we bring new clients in, given the fact that we are not sure where they may have been prior to coming to Our Ladies Inn. So we have devised a plan where we can do a quarantine period for new clients. And then once they have proven not to be infected, then we can have them mingle with all of the other clients in our building. There's Our Ladies Inn had set some goals, and we were looking at a birth weight of 5 pounds, 5 ounces, and a mom delivering at 37 weeks. Well, last year we have superseded that. Our birth weights are higher, and our amount of time for gestation has increased as well. And we accredit that to being here and providing the service that we give them, because had they remained homeless, we never would know what the outcome of that unborn fetus or the mom or her dependent children would be. Once they have come into our program, we're not just focused on what the mom's needs are, but we also focus on the children, because just as children, moms have been traumatized, so have the children, because they're in that experience with her. So with providing play therapy and, having children that are underdeveloped in their learning skills, connecting them with Francis Howell School District and Meadows Parkway, getting our younger children the assessments they need to know where they need special attention in their education. We have children that come in with physical delays, and we connect them to First Steps. So it's about joining them to resources to help the entire family and not only focus on the mom. Right now, we are working with a group of women that, since COVID had come in, they were able to receive funding because they lost their jobs. And those funds, as a part of our program, are used so that it can help them towards self-sufficiency. And a few of them were able to purchase transportation. We have some moms that did move out, and they're now in permanent housing. So even though COVID had occurred, then the program at Our Ladies Inn, we continued doing what we needed to do, just having the opportunity to find a different way to do it. So, if there is any questions?
I had one comment on your application with your first outcome statement that you have. I would suggest it's more of an output. It's describing something that you will provide, that clients will be evaluated. If there's an opportunity, I would suggest maybe looking at a stronger outcome statement that really focuses on some type of knowledge, skill, or behavior change with your clients rather than they receive an evaluation. So that doesn't really tell you what change happened with the client.
Okay. I kind of heard your question, your comment, but not completely.
Okay. It was
So
with the first outcome statement that you have in your application. I would suggest, and Pinar, I don't know if there's an opportunity to do this, but to select a different statement, because what you have here is more, it's a service that you're providing. It doesn't really show any change in the clients, just that they've received a service. And so switching that out to an outcome statement that focuses more on some type of knowledge or behavior change in the client.
Okay.
So if that's okay for the board, Denise can send me a new output and I can replace it. Does that work?
Yep. That's fine with me.
Okay. We will do that.
Anything else?
I don't think so. All right, thank you, Denise.
All right, thank you.
All right, next up is Karen with Volunteers in Medicine.
be great instead of me ripping it off. Look how much better this looks to go home.
Okay, can you hear me?
Yeah.
Okay, I'm gonna try to pull up a presentation. There we go. Can everybody see this?
Maybe you need to switch your camera.
Yeah, it looks like we see the ceiling right now.
I'm sorry. Oh,
There you go.
can you see the presentation?
Yes.
Yeah.
Okay, I'll just speak to this, be easier to follow. So once again, thank you for your support and the opportunity to present tonight. Volunteers in Medicine has been serving St. Charles and Lincoln counties now for 24 years. And as you know, it was developed out of a need by a group of concerned citizens 24 years ago. We do see adult patients who are not eligible for other medical insurance or assistance. And we have chronic illness patients that we see, a lot of diabetes, heart disease, chronic obstructive pulmonary disease. We're open just 2 days a week by appointment only, but we have a large network of medical specialists that we're able to refer patients to, and local hospitals, including SSM and Barnes St. Peter's, do our testing, including blood work and diagnostic testing for free. We do have an all-volunteer staff, including doctors, DOs, nurse practitioners, RNs, dietitians, counselors, pharmacists, and students. Although obviously the students, we are seeing pharmacy students again now, but they weren't around in the spring. If we take a look at 2019, our value of services, we had a total of, well, over 11,000 on-site volunteer hours, which are valued at over $500,000. We provided $2.3 million of services on a budget of $159,000. And that includes 379 off-site referrals to specialists or to physical therapy, and also includes 1,137 off-site tests and procedures. We had 3,578 patient visits, which was down 6% from 2018. And we dispensed over $1 million worth of pharmaceuticals, which included outside pharmacies, which was a total of $85,000. That's what we pay for out of our money that we're requesting from you all. And then we gave away pharmaceutical samples, and dispensary of Hope medications was $122,000. And then we got assistance from pharmaceutical companies where patients can get free medications if they qualify financially. And that was $850,000 in meds. Our return on a $1 investment was $14.7, $14, over $14 in healthcare is what that amounts to. Once again, that's just taking the amount of care valued that we give over what our budget is. Okay, as far as what's been happening this year, last year in June, we started implementing this Dispensary of Hope's pharmaceutical program. Basically, the clinic pays a yearly fee of $7,500 for unlimited commonly prescribed drugs, and we're able to order those weekly, and they're to us weekly on an as-needed basis. Patients have those prescriptions filled and picked up at the clinic. It decreases the number of drugs filled and paid for at an outside pharmacy. We continue to estimate a savings of $15,000 by the end of 2020. And I have a separate chart on that, which we'll take a look at later. We started limited telemedicine appointments only in late March through early June. Typically, we probably would have 25 to 30 appointments a day, and we probably had 4 or 5 appointments a day in the March, April timeframe. Then we started seeing a limited number of in-person appointments in June, obviously with full PPE, and that is now increasing weekly. We're continuing to provide medications refills at the clinic and at outside pharmacies during COVID. In fact, we, even though we had a smaller staff during COVID in March, April, and actually all the way through now, we continue to provide the medications for our patients. Basically, they wouldn't come in. We got a doorbell system. They'd ring the doorbell, tell us what they needed, and we would get their medicines and hand them through the door. So we were trying to be as safe as possible. I guess the other thing to keep in mind, we continue to have a more skeleton staff of about 10 people every day. Typically, we'd have up to 20 staff there in a day's time. But also that 20 people, we were all in our 60s, 70s, and 80s in some instances. But we wore our mask, and so far we've not had any instances of COVID. So an interesting thing happened in June. As you all know, CVS took over the Schnucks pharmacies. And so we were kind of forced to develop an agreement with CVS to get our medication still at the Schnucks pharmacy, but instead it was CVS. CVS corporate would not give us visibility as to the cost that we wanted, but we were in the middle of COVID, so we said, okay, we'll go ahead and sign up for this and see what happens. Fortunately, our medical director was working on a plan B in the background with SSM in case this CVS agreement didn't work out. So we changed to CVS in June, and we had a 50 to 100% increase in our cost. I got a chart, I'll show you that. You'll see that on the chart. So fortunately, we had SSM ready to go in our back pocket. So the very next month, we were able to switch pharmacies to the SSM Health Pharmacy, which is in the SSM clinic on the service road. So now our patients go there, and their costs are very much in line with what we were paying at Schnucks in the past. We're currently also receiving some free meds on some scripts from RX Outreach due to the CARES Act funding through the end of the year. We have a limited number of drugs that are more expensive at Schnucks or at SSM, so we would go to RX Outreach because they had a better price. The disadvantage of RX Outreach is that it takes a week for them to send the meds to us, and then the patient has to make another trip back to the clinic to pick them up. But in some instances, it's worth the savings to do that. So anyway, it probably amounts to just a couple $100 a month, but hey, it's free through the end of the year. So far this year, we've dispensed about $61,000 in value in terms of clinic pharmaceutical samples and DOH drugs. This excludes insulins. And we've dispensed a little over 50,000 in clinic paid prescriptions to Schnucks, CVS, SSM, DOH, and RX Outreach. We've had 3,173 patient appointments. However, 68% of the patients came for Vim dispensed prescriptions. So even though we were down seeing patients in terms of the doctor seeing them in March, April, and well, up until now, they were still coming to the clinic to get their prescriptions, and that was counted as a patient contact. We've had just 68 new patients this year. Obviously, that's down, I think, by a good 50%. Our clinic nurses continue to draw blood for SSM designated patients, and those samples are picked up by SSM at noon on the days that we are at the clinic. And we also got a Lindenwood grad student this year. It was starting in March, right before COVID struck. And he's been coming 2 days a week and providing counseling. And that was certainly a timely acquisition. And we hope to continue with Lindenwood in terms of getting a new grad student on a yearly basis who can provide counseling for our patients. He is busy every day. So just wanted to share a couple of charts. As part of our Dispensary of Hope program, we are providing monthly metrics to the Dispensary of Hope so they can see how we're utilizing the program. And I just wanted to point out that if you look at the top line, this is called 30-day scripts. So this shows you the amount of 30-day scripts that we issue every month. And it was really high. I mean, it was up to 550, almost 600 in both March and June of this year. March, I understand, because COVID struck and everybody wanted to get their meds refilled. But typically, we have probably more like between 450, 500 30-day scripts that we issue every month. The number of total patients, which is in the royal blue, that is basically the total number of scripts that a patient got, whereas the unique patients are just like one patient might get 3 scripts, but it just counts as one unique patient. So as you can see that has steadily climbed since June of last year. Okay. Then the next chart, this is interesting, so you can see how our costs have gone down. If you look at January 19th through May 19th of last year, our average pharmaceutical cost to an outside pharmacy was about $75. I think that's like $7,300. As you can see, that number has steadily gone down. And it had gone down to, it was, usually around 4,000 or so a month. And then you see that really high blip in July of this year. And that reflects the 1 month that we had to go on CVS cost. But now that we've gotten back with SSM, our costs are running around $3,500 a month. So that is certainly in keeping with the direction that we were going in. So that's really a big plus in terms of having that support from SSM, who has been one of our partners ever since we started the clinic. And then the last chart, I showed this last year. This reflects the improvement initiatives that we've made to decrease our clinic paid medications. So if you look at 2015, I mean, we were averaging about $112,000 a year. Our pharmaceutical costs were at least $10,000 a month, or close to $10,000 a month. So we started doing some automated inventory, giving out more samples, and then last year with the Dispensary of Hope, that put us in another downward trajectory, and we hope to decrease those costs down to about $57,000 to $58,000 by the end of this year. If we continue doing this. And the reason that we're really trying to decrease the cost is we have to start over every year in terms of getting new grants and raising funds from, fundraisers or individuals or whatever. So once again, we're trying to decrease the cost and provide even greater value to our patients. Basically, we're using more staff, but fortunately we have the volunteers and they're not paid. So, we're able to do that. So thank you once again for your ongoing support. And at this point, if you have any questions, I'm happy to take them.
Dave has a question.
Any questions?
Dave,
Karen?
Yeah.
Karen, this is Dave.
Uh-huh.
What's the deal with CVS Pharmacy? That's terrible.
Let's see. Well, yeah, it was. We
Yeah.
had to go through, once again, Schnucks, a local company, lost control because they're under a big corporate umbrella. And, we asked for the same pricing and they said, well, no. And, we were kind of in the dark about what they were going to be charging. And, like I said, as soon as we got that first bill and we saw how high it was, fortunately SSM was, there as our backup. So we, changed over to them, but CVS came back saying, well, we'll work with you and try to give you the same prices that you got at Schnucks. And we were like, why didn't you do that to begin with? It's too late. We've got another partner and thank you very much. It wasn't a reflection on Schnucks. Schnucks has been a great partner of ours for the last 7 or 8 years. Right. And the pharmacists were great there, but oh man, when CVS took over, it's like, and we had even agreed on guidelines and they weren't following them, and it was really bad. They were trying to charge patients co-pays, and if the script was too expensive, they'd say, well, we'll just give you 2 weeks and then you can come back in 2 weeks and get the rest of it, because we have like a $50 limit on our scripts. So right. Anyway, but it worked out just great, and SSM has been wonderful, and our patients really like them also.
Do you think going forward, Karen, that if you would need to, CVS would come around and act more reasonable?
I'm sorry, what'd you say again?
I said that going forward, do you think CVS would act more reasonable if you had to work with them?
They might, but we don't need to work with them. So, it's like, it was pretty upsetting when, it's like, oh, now you want to work with us. You would not work with us, before, when we were trying to set up the agreement that we signed up to and everything. Right. But it was only when we were going to leave that they said, well, we'll try to work with you. And we were just glad we had something in our hip pocket that we didn't have to work with them. So,
well, shame on them.
Yeah.
Okay. Thank you.
Okay.
Hey, Karen, I had a couple of questions. I appreciate all the data. I'm a data nerd, so I like all the charts. Is there any ongoing education that the patients do, especially like for a DPP or, possibly moving off of medication so they aren't reliant on your services?
No, there really isn't. I know we had a nurse that worked there. In fact, it was a friend of mine, and she had worked her whole career in at St. Luke's, and she did wellness and prevention. And she goes, it's just a different mindset to be in a clinic where you're working with patients that are sick, and they're not into the whole wellness aspect of it. And part of it, it's like, no, we haven't done that. Part of it is just in part the nature of our clients also. But no, I mean, other than, the doctors, obviously, if they think that the patients can get off certain medications, they'll do that. But no, I don't know if that really answered your question.
Yeah, that was what I was just thinking of all the staff that you use. You were talking about just their different roles, and if education and prevention was just part of that model.
Yeah. I mean, obviously we have a nurse, a couple of nurses that are diabetic educators, and they do a lot of diabetic education, and we do have a lot of diabetics. So that, I guess, yeah, that is something that they do get a lot of education on. That's something that's, pretty complicated, and, they need a lot of support on that. But are we giving a lot of additional education? No, not really.
That's perfect. Thank you.
Mm-hmm. It's been a challenge, but at least,
Karen,
no one's really had to go without any kind of medication. And if they've needed to talk to a doctor, a doctor has always been available, for them, by phone. So. I think that's pretty similar to what the other clinics were doing in the area, throughout the COVID. So.
Well, I just want to say thank you to you and to everyone else who has continued to keep your doors open and demonstrated extreme creativity in your ability to pivot and adjust and be able to continue to serve clients. It's everybody who has presented tonight. Question for you, Karen. These are some great stats that you presented. How do you track your patient outcomes? What do you what are you aiming for? Is it that they're able to, if they have a disease, that it's disease management, it's decreases in X issues? So that's what I didn't hear you talk about that, and I really don't see your outcomes in your application. They're really more process outputs. So what do you do to track, how do you define patient success, and what do you do to track that?
Yeah, you know what, Melinda, that is something that, we really do not do a whole lot of at all. We do a patient survey every year in terms of their satisfaction. I think we have about 5 questions on there in terms of their satisfaction. And obviously we always get, very excellent scores on that, but we have not been able to set up metrics for that. And that is a shortcoming that we have. And quite frankly, part of that is the fact that we don't have a staff to do that because everybody's a volunteer. And quite frankly, everybody's busy just delivering services, and we're not doing that measurement. But I concur with the fact that we should be looking at that.
Thank you.
Any other questions?
All right, thank you, Karen.
Thank you.
All right, last one, Cheryl with NECAC.
Karen, could you please stop sharing your screen?
Oh. How do I do that?
Same place, just from the share tray. You will. There. It must be stop presenting.
I'm gonna put myself on mute.
Thank you.
There we go. Melinda, did you have another question?
Okay.
I see the little.
No, I
hand.
forgot to take my.
Okay. Just making sure.
My hand down. Sorry.
All right, Cheryl, whenever you're ready, you can go ahead. Is Cheryl on? I don't know that.
Cheryl was on. Where is she now?
Oh, it looks like actually.
She was here, but no, she's not. She must have disconnected, I guess, because she was here.
Does anyone by chance have her phone number or contact information?
I don't have. I'll just email. Maybe she will.
If not, I'm sure we can probably just add her on to November's meeting.
She was just here. Maybe she is disconnected or something.
Can you hear me okay? Let's change access. Okay, wait a minute. Webcam access allowed. Okay. Can you hear me okay? Can you see me okay?
Yeah.
Oh, good. Okay. It kicked me off. I'm thinking, of course it would happen. I'm the last one and it kicked me off. Okay. Hi, everyone. Good evening. I'm Cheryl with NECAC. As you know, we are a not-for-profit organization. I'm going to try and read a lot of this so I can kind of move along pretty quick and go back and touch on some things. NECAC has been in business since 1964, so the organization is 54 years old. NECAC has 12 other offices throughout the Northeast Missouri County. Of course, 9 of them are in the rural areas, and we have the 3 in the metro area, which is we know as the Tri-County, Lincoln, St. Charles, and Warren counties. NECAC delivers social services, community health, public housing programs to those who are low income, youth, elderly, disabled, and those who are at a disadvantage. Services are made possible through contracts and grants with federal, state, and local government, as well as not-for-profit organizations as well. Over the years, NECAC has maintained a strong presence in the community, establishing a strong reputation or a solid reputation in regards to clean and proper financial audits and monitoring reports. So we're thankful with the team that we have in our central office to really work hard on those reports. Our mission here at NECAC is we're excited to continue the path in making a difference by empowering those we serve and encourage their efforts to rise above the poverty and change for the better while building strong communities as they continue to work towards stability. So we really encourage our clients, the people who come and see us for any type of services, whether it's weatherization or just staying in their home, to really work on stability, empowering them to do the work themselves as we give them the tools to do so. So also with our mission as trying to making sure they stay, I want to say stable, give them the help they need. We also provide case management, and case management is it's really required for the clients when they come in for any type of rental assistance. So through case management, we have noticed that the clients actually discover their strengths and actually gain some self-esteem. So that's really huge. So when the clients do come into the office and they want help with rental assistance, we have to gear them towards to contact coordinated entry, because we have to go through that process. So they go through coordinated entry, and eventually we may get the referral, maybe another agency, but a lot of times we get those referrals and then we move from there, calling them, contacting them, making sure that they have the tools they need. Of course, we have to gather all the documentation. They have to bring in ID, Social Security cards, proof of income for the last 30 days. The eviction notice and all of those items are needed for verification and making sure that we're helping those that are really, really in need. Sometimes the clients come into the office instead of calling. We have a few that have come in the last few years that actually are literally homeless or living in the elements, living in their car. And you can tell when you go out and you try and talk to them and find out what's going on, what the needs are. They're actually living in their van. With cases like those, we actually get those individuals into the office and we call with 211, a coordinated entry. We make the call together. And a lot of times we're successful to get them on the phone. Sometimes we're not. And it's really hard when we can't get them on the phone because they need help and they need help then. So if we can't, I can also send an email to coordinated entry and they are able to get in contact with us and we actually come up with a plan. Whereas to talk with Jamie, they actually get some of those clients in a hotel that night. So I just really like working with our community partners. Without them, I mean, we would be at a loss because we don't house them, but, you know, our community partners have those, you know, funds and have that type of setup to do so. So we really are thankful for our community partners. NECAC we're asking for $35,000. With that $35,000, that is going to assist 45 families or 113 individuals. With bundling services, that would help save us some money, whereas we do not have to use, you know, all of that funds towards one client, because with the funds last year or last project year, I believe they can get up to $1,500. So with us bundling services and reaching out and working with our partners, such as St. Joachim and Ann or Link or even Calvary, we're able to not have to spend so much on that one family and hopefully save that for the next person. But with St. Charles County, the housing, affordable housing is just not there. The cost of living is so expensive. So when they miss 1 month of rent, that's $800 easy, or $900 or $1,000. If they're missing 2 months, could be $2,000, $1,600. So a lot of times what I like to do is encourage the clients to also engage in helping themselves. So I'll ask them, can you come up with $200? Can you come up with $300? What can you come up with, even if it's $50, just to be engaging? So sometimes that works out, sometimes it does not, because they don't even have $5 to get gas. So again, they're calling coordinated entry to try and secure a gas card. But yeah, I do ask them to engage if they can. Homelessness, and with the clients that we serve, it's 58%. So with the numbers that we did get, it shows 58% for the clients that we serve. If they are able to locate affordable housing, and that's really hard in St. Charles County now, they are in need of rental deposit. So once again, we are, you know, contacted through coordinated entry with referrals to help with rental deposit. We're showing with some of the people so far for 2019 that we have mental illness. 5% of the population have mental illness, and then 10% are ex-offenders. But we do know those numbers are really higher than what we've seen. But a lot of people do not want that stigmatism. They do not want to report that they have some type of mental illness or if they're ex-offenders. The women and the men, as far as the population we serve, it's almost equal now. So the numbers have really risen. So for men, we serve about 52% and women 48%. So it's almost equal. So these funds will assist with permanent housing and homelessness. It would prevent homelessness, keeping them housed and keeping them from facing eviction due to the loss of jobs. Sometimes they're not only through loss of job or a loss of hours, reduced hours, but it could be a family member that's sick or a spouse or a child. And a lot of times they lose their job because they missed a day of work, and they come and see us. Through COVID, it's been different. It's been trying. We did close down for about, to the public that is, but we never closed down, but closed our doors to the public for about 3 weeks. And we reopened, I believe, May the 4th or May the 7th, we reopened. But we reopened to the point where we had a drop-off box, or social distancing was put in place, or a ticketing system where you get a number and please be seated. So we're still working on that because they're so fast who want to just come in, even though you know, COVID is in place. We're asking everyone to wear a mask. If they don't have one, we do supply them with a mask. And thanks for some of the community partners, they also provided masks. So that was great as well. So we did put in place a plexiglass. We didn't have any volunteers during that time, so that was really tough. It was pretty slow around, I want to say, May, June, when we did reopen again to the public because of the stimulus money that they did receive. So that kind of slowed things down. But when mid-July and August hit, it was a zoo in there. It was unbelievable. Our numbers per week, it went from maybe 300, clients that we served to 500. To the most we received was over 800 clients, visits and calls. So we were overwhelmed. And I mean, we couldn't even catch all the calls. They had to go to voicemail. One of the things I think that's unique about us, because we have live calls, when they call, we answer the phone. During that time, a lot of those calls went to voicemail because we just could not keep up. The volunteers, like I said, wasn't there. They couldn't come. The volunteers we received from the community college, they were doing everything virtually. So now things are kind of picking up as far as volunteers, so we have help. And even though we had a little break maybe 2-3 weeks ago, it's picking up again. So a lot of people had depleted their funds and have not found jobs. So it's getting pretty busy again because of COVID-19 and like I said, lost in hours and lost in jobs. So our overall goal for NECAC is to pretty much minimize, if we can, homelessness, and hopefully bring that to an end, if at all possible, with the help of our community partners and with the help of the funds that you guys provide, so that you graciously provide for us. Again, with assisting or budget, I wanted to say bundling services with our energy assistance that really help to save some money as well. Our Skill Up program to help with education and help with training and help with job searching. So we work with the clients that way too, so that they can become self-sufficient. So that's the whole goal, so they can become self-sufficient, stable, and live in affordable, stable, clean housing. So that's one of the main goals that we have. Some of the community partners that we work with would be workforce development, of course, Connections to Success, Coordinated Entry, St. Vincent de Paul, Murray's Goodwill, their CSEP program. We do have some volunteers who get the chance to earn a wage for volunteering 20 hours a week, and that's a really great help for them. And they have to be 55 and older. Also, CAS, which is our Community Alternative Sentencing Program, we work with them as well, where they have clients who need to, it's like an alternative program to gear them away from having to do time in jail for violation of DWI or some type of drug or speeding ticket. So they are committed to volunteer at an organization, non-for-profit organization, whereas they come and work with us and work that time off. So we partner with them as well as reemployability. So those are people who are injured on the job and they have gone through surgery or some type of therapy, and to get them back ready to do an 8-hour day, they come and work for us. So we have some really great community partners. Another goal would be to have 100% of our clients receive clean and stable housing, as I mentioned before, and to have 100% of the clients, or well, maybe 96%, hopefully, of the clients engage in case management and or targeted coaching. So we have that option as well. So as far as case management, we want to follow them every month throughout the contract year. Some even longer, because they like that, they like the services that we provide. They like being able to have a voice, able to make a decision and make short and long-term goals. So sometimes we follow them longer. Sometimes we just call, how are you doing, and see what's going on and find out something else has happened. Let's see, targeted coaching, that's pretty much like people who, really don't need a lot of help, but they want help with budgeting or help with a resume. So we'll work with them with that as well. Let's see what else I wanted to talk about. I'm trying to hurry because I know my time is limited. My time is very limited. Okay, so we're also asking for, and I know the CARES funding, they're asking for $5,000 to help 10 families at $500 each per individual or for family. And that's for people who are receiving case management. So if they're receiving case management, they can get additional assistance, such as car repairs or let's see, the health care assistance as well. So we're asking for that as well. Those that we assisted for 2019, we have assisted like 10 homeless individuals for 2019 with those funds, 10 adults. Between the two, between the homeless and the adults, there was a total of 19 children that was helped as well with those families. Indigent, we had 4 households for that year, and 5 adults and 11 children. As far as those for 2020, so far with these funds, we have helped 9 homeless people. We've had helped 10 adults, and between those two was 8 children in those households. Indigent were 3 households and 3 adults so far and 1 child. But it's only like it's October, and we still have time to go because we're still getting calls. So I'm sure those numbers are going to increase greatly. But due to our Section 8 housing, the wait list is closed. We're not able to serve the families that really need help because of the funding was depleted because they had to close it. A lot of the families lost jobs, weren't able to pay their rent. So some of the funds got depleted as far as trying to keep those families housed. It's so much easier to keep the families housed than it is to start all over again. It's much more easier to do that. Let's see, 100% of our people do not return during the policy year for rental assistance. So we do know 100% do not. But over the past year, I noticed I have received 2 referrals for the same people who did get help the prior year. So that number is pretty high, whereas only 2% or well, maybe 20% or less than 20%, I would say, that come back and return. So last year, we try to keep this very much balanced or equal. From the household income 0 to 25%, we helped 50% of those people, and then 26 to 50%, we helped 50% of those people. So we try to pretty much keep that equal. I think I pretty much gave you a lot of information. I just want to make sure that you know what our outcome is to make sure they have stable housing and that they become self-sufficient and they take on the tools that we teach them and provide them, and so that they can thrive within their community. Let's see, and one story I do have, we have a family, a young man and a young woman. They were almost homeless. And he lost his job, and she was pregnant, and she was told that she couldn't come back to work because of her condition. She was pregnant, and they were afraid that she would contract COVID-19. So they were received an eviction notice. We were able to help them get them back on track, but he had lost his job, and he was desperately looking for a job. And through Skill Up, we were able to help him get a job. So I did see him last week, and he was so thankful and so happy to let us know that the work that we do, they are really proud of that we are here in the community. But once again, we couldn't do that without the board. You got your help and all our community partners. So as St. Charles continues to grow, so does the need for the funds. They also continue to grow. Each year there is a lack of funding for such an important task, more affordable homes, and also a development. We continue to work with others in the community, with our community partners, and bundle services that allow us to stretch the funds to be able to help more people. We're able to bundle other services that NECAC administers, such as LIHEAP and our ESIP program, weatherization, and Skill Up. The NECAC community is very appreciative to everyone on the committee who made it possible to allow NECAC to continue helping those in need. The decision you have made and all of your efforts have not gone unnoticed. And for that, I wanted to say thank you from the NECAC team. So do you have any questions for me? No questions? Oh, wait a minute. Let's see. Something's not working. Okay, I can hear someone now. Okay.
All right. Thank you, Cheryl. Thank you for all that information.
Okay. You're welcome. Thanks.
Does anybody have any final questions for Cheryl or anybody else?
I do have a question. This is Robert Meyer, St. Charles County. My question, can you hear me? Cheryl,
Yes,
my question for you is, I know this is a corollary to what you were talking about, but I've heard several comments, but I'm just looking for your opinion because I've never personally called the 211 number.
Okay.
But I have had people tell me when they call the 211 number, they're unable to get through, or they have to wait a long time to get a response. I don't know if that's typical, but it sounds like you have been personally involved with helping people through that process. So what's your experience been like? It sounds like sometimes you're able to get through directly and immediately, and other times you can't. But what's your experience?
Yeah, that's true. We hear a lot of that as well. And our committee on the COC Executive Board, we're working on that project as well. And they should roll that out at our COC meeting this Friday at 9 o'clock. It's been kind of tough sometimes because they didn't have the staff. And they're inundated with so many calls. So what we have done, I have actually have a plan to contact Jamie personally myself if I can't get anyone with the situation. Sometimes the situations are real dire, and I know that's really hard. And everyone do not have that landline or that line to Jamie. But yeah, I have personally done that, and vice versa. They call us if something is needed right away. But that email system is it's a really good tool because they will get with you within maybe 10 minutes. Sometimes if they're super busy, it might be an hour. And that's one of the things that we're changing come hopefully soon, that we want the clients to also have the access to the email address so they can email their requests or their concerns.
Okay. Someone I spoke with who called me said that when she called the 211, she had to input her zip code, and then she was routed that way to the St. Charles County's coordinated entry. Is that your experience too?
Yes, because now they've got new cards, and that was another like a little bump because due to COVID, the options changed. It was, press 5, put your zip code in, and then choose 3. That changed due to COVID. Now you have to choose option 2, put your zip code in, and then choose option 3. So now we have new cards. So it's a process because every time someone calls, about coordinated entry, it may take 5 to 10 minutes to really walk them through and make them feel comfortable and let them know they will not speak to a live person. But if you leave a voicemail message with a good phone number to call back, they will call you back. And I explained to them, if just let them know when they call back, it will come from an anonymous number. Please pick up that number. So I continue to teach that over and over, and just let them know they will not call you back. If they called you, left a message, you have to call them back. Oh, I'm sorry. I almost fell there. So I just want to make sure that I explain those things to them. And it makes the process a little easier and they kind of understand, but it's really hard because they don't know the process. And sometimes they're so inundated with, their problems or their crisis that they can't even take, simple instructions. So a lot of times, if I can, we'll call together, or I'll call for them, or I've done it many of times, sent an email. And when they see my email, they will really get back with me, and I really appreciate that.
I would like to add also, and currently because of COVID, I guess, I started to get calls about rental assistance, and I am referring them to 211. Mm-hmm. But I strongly encourage them now, please, I am telling them they will be returning you for sure. So please leave a message and if they don't get back to you in 48 hours, then please let me know, I am saying. And so far nobody called me back. And coordinated Andrew is following up. And today at the COC meeting, it was mentioned again that the calls almost tripled per week, but still they are trying to answer the calls in 24 hours if they are urgent. But for regular calls, they are trying to get back to them in 48 hours. This is what I know.
And they document every call. They're supposed to document every call. So that's how I know too if they really called. And if I don't see any notes out there and they're adamant that they called, I'll email them and say, hey, there's no notes in there, and the client said they called, and you know, and they'll get pretty much on it. But it's a work in progress. I mean, it's a lot because you got a lot of people coming at you due to COVID, especially.
Okay, thank you. Appreciate it.
Let's see, Christy, did you have a question?
Yeah, can you hear me?
Yeah.
Okay, I'm Christy Weber with Community Council, and I can speak to that just a little bit about 211 and coordinated entry. It really is a call volume situation. Jamie and her team do an amazing job, but they are not ever able to answer live calls. It always goes into voicemail. And like she said, they kind of go through the list prioritization. They do try to get back within 24 hours, and there are, I know one of the big problems is definitely the callback situation. A lot of them don't have a phone. They're using somebody else's phones. So it's, I know they're working on constantly. I know we've added a couple different case managers this year. With there was some additional funding coming in from COVID, and it was also, they were able to maintain it there for a while until July, August, and then when PPP funds started running out for people and their unemployment, things like that, the call volume has gone up about 20% just since July. So they are working on that, and I do appreciate that NECAC is able to take live calls because that's a huge thing, and I know coordinated entry is working towards that hopefully in the future.
All right, thanks, Christy. Did anybody else have a question? John, I thought I saw that little hand raised. I don't know if you had anything you wanted to say. All right. Well, if nobody else has anything.
I think John was muted.
Oh, was he?
Yeah, he's muted.
John, did you have anything you wanted to add?
He's still muted.
Let me see if I can.
I can't see him on the screen, so I don't know.
Yeah.
Well, I guess, John, if you have anything, maybe you can send it through the chat. Otherwise, did anybody else have anything? All right. I guess we'll just need a motion to adjourn.
I make a motion to adjourn.
Second. Oh. John said never mind. And I guess one more quick thing, just thank you everybody for your presentations tonight. They were all very very good, and I know it's been a tough time for everybody this year. I can't believe it's already been, you know, since March, and this is still going on. So, you know, hopefully 2021 will be better, right? So, all right. I think we just needed a second, and then. All right, all in favor?
Aye.
All right, thank you. We'll see you guys on November 10th.